With people working from home, have you thought about how much stress you put on your hands, especially your joints? Endotech is a revolutionary surgical instrumentation system available exclusively at the Fitzmaurice Hand Institute. Endotech is minimally invasive, and it's used to treat a variety of conditions using the smallest incision possible. This approach can dramatically reduce pain and recovery time. Here to talk about the Fitzmaurice Hand Institute is CEO and founder, Dr. Michael Fitzmaurice. Thank you for being here today, sir.
Switch hands.
So tell me, what is Endotech?
So it's an endoscopic system we developed because I didn't like the options for doing minimally invasive surgery for hand. So I developed a endoscopic system using a very small, less than 1 centimeter incision. And it can go in through this incision, and the key is it can see all the structures with greater clarity than any other systems available previous to that. So the key to that is you can safely perform procedures with the minimal risk. And it's several procedures can be performed with that. We do it for carpal tunnel, we do it for trigger finger, there's a Dequervain's tendonitis, even a nerve problem in the elbow. So a lot of common hand problems we can do. And if you see here on the animation, you'll see the minimally invasive. It goes in, we see the structures, we can release the problem area. And the key with this is the recovery. So you have a small incision compared to a large incision. And the small incision, you just need a Band-Aid. You could start moving your hand right away. And the opposite hand there, which is the traditional surgery, you see it's just a large incision. It takes a lot longer recovery period. And they often need sutures to be removed, which can require another visit. You know, this one, we use absorbable sutures, so the patients can often have even a telemedicine visit to avoid an unnecessary trip.
And so why does Endotech help your surgeons achieve like the best possible outcome?
It's really because it allows them to perform these common procedures with such a minimal incision, and to safely, again, the key is safely see all the structures. So they have the confidence of knowing they can perform these common procedures safely. They're seeing everything. It's not like they have to convert to an open procedure. All the patients then recover much quicker. There's less trauma to the tissues. Because it's done with such a minimally invasive procedure too, our surgeons are able to do these under local anesthesia. So again, we just numb it up. And the big difference there is other surgeries, they often have to put the patient out. The risk of anesthesia is greater than the risk of the surgery. So our patients, they can often drive themselves to and from surgery. So you have the safety of the minimally invasive and also being able to do this under local anesthesia. You don't have the risks. You don't have patients having to have unnecessary medical tests just to have a procedure done. So it's much better for them.
And what are some of the conditions with hands and wrists that your surgeons have done with Endotech? Common
nerve problems, nerve compression at the elbow, nerve compression at the wrist, problems with the fingers called trigger finger. There's a tendonitis. And those are the more common procedures that patients come to the office for.
And the patient care experience, I've heard some great things about that. Can you talk to me a little bit about that?
Well, we focus more like on a concierge approach. And we also kind of combine more of a holistic approach, meaning we incorporate nutrition and supplementation strategies with this. So not only do we want to provide a minimally invasive procedure, we also want to assist them with anti-inflammatory diet regimen, certain supplementations that can help them improve too. So it's a combination of having a minimally invasive surgery with some nutrition guidelines, and we feel we've had the most effective and the best outcomes within the hand surgery community.
So I'm sure, like many viewers that are watching, they might have more questions or just want to read more about Endotech. Where can they go?
Absolutely. They go to our website, fitzhand.com, and then they could go to the Endotech section there and learn all about this particular instrumentation system and the treatment options that are available.
Thank you so much, Dr. Michael Fitzmaurice. It's a pleasure having you on today.
Thank you.